Hey parents, you're listening to the Project Parenthood podcast. I'm your host, Dr. Nanika Coor, clinical psychologist and respectful parenting therapist. Each week, I'll introduce you to the same respectful parenting practices that I use to help parents repair and deepen connections with their children. You'll get tips for cultivating more parental self-compassion, more cooperation from your kids, and more joy, peace, and resilience in your relationship with them. In today's episode, I'm talking to Dr. Funke Afolabi-Brown, a pediatric respiratory sleep medicine physician who helps parents and children prioritize sleep for optimal physical, emotional, and mental well-being. You're going to hear about how to manage your own mental restlessness at bedtime, how to gauge how much sleep your kiddo needs, and how to build good sleep habits right from the start. Stick around till the end to learn how the labels you use to describe your child's sleep habits might be getting in the way of their sleep. Dr. Funke Afolabi-Brown is board certified in pediatric pulmonary medicine and pediatric sleep disorders. As a double board certified pediatric respiratory sleep medicine physician, Dr. Brown helps her patients breathe better and sleep better. By extension, she helps improve the sleep of their parents. Based in Pennsylvania, Dr. Brown is a speaker, an educator, a writer, and founder of Restful Sleep MD, where she helps busy professional women and their children prioritize sleep to not only achieve their optimal health, but also thrive and live to their fullest potential. She does this through courses and programs focused on educating and empowering busy professional women to make sleep a priority as a critical pillar of their health. Dr. Brown does this work to help families learn how to create the best version of themselves without sacrificing their health and losing sleep. Here's my chat with Dr. Afolabi-Brown. Hi, everyone. I'm here now with pediatric pulmonologist and sleep medicine physician, Restful Sleep MD, Dr. Funke Afolabi-Brown.
Thanks for having me.
Yes, so glad to have you here at Project Parenthood to shed some light on how we can step up our kids' sleep hygiene.
I love it. I'm all about that.
Yes. So, before we jump into talking about the how-tos of restful sleep for our children, can you tell us a bit about what sleep pulmonology is and what you do as a sleep medicine physician?
Absolutely. So pediatric pulmonology is really a very relatively small field, I would say, and relatively new in the sense that it's been around maybe a few decades compared to a lot of the other subspecialties, right? So what this entails is someone goes into training as a pediatrician. So you first get your training as a pediatrician, and then you go ahead and get an additional training to be a pulmonologist. And so the real focus is on children that have breathing issues. So that could be anywhere from things that like asthma, things like different lung conditions, having recurring or multiple pneumonias and lung infections and things like that. And then also some rare conditions like cystic fibrosis and things like that. So really that's under the umbrella of pediatric pulmonology. And then I went ahead and did an additional training in sleep medicine, really to then own in my skills on helping people sleep better. Because one of the things we know is if you have breathing issues, then your sleep is going to be affected, right? If you have stress in your life, your sleep is going to be affected. And if you're battling an illness, we have been in the middle of a, pandemic for like the last 2 years right now. And so a lot of children's sleep and their parents' sleep is affected. So a lot of the work that I do is focused on helping children sleep better as well as their parents. One thing we know is when children are sleeping better, then automatically, hopefully, their parents will do the same.
Absolutely. Absolutely. Thanks for that explanation. And speaking of parents, one more thing I want to touch on before you start talking about the kiddos is what are a couple of tips for us as adults to calm our racing minds so that we can get some sleep? Sometimes you just lie down and your mind starts going and, what are some ways for us to get into that restful mode?
Yeah, no, that is such a common entity. And that's the reason why I said even sometimes many times we may blame our sleep on our kids. Like my kid doesn't sleep and comes into my room and wants to co-sleep with me and all that. And so I don't sleep. But then we now get to the point where, oh yeah, my kid is now sleeping well on their own, yet I'm still not sleeping. And for many parents, it's that racing mind, that endless to-do list, the list of things you should have done, you could have done, you would have done, that keeps running this endless loop in your mind. And so a lot of times what I recommend doing is first stepping back to seeing why that is going on. Is this like a one-off thing, or is this like something that's happening over maybe a period of a few days because you're undergoing a lot of stress? Or is this something that's been going on over a very long time, in which case we do need to address it because it might be related to insomnia, which is when you have difficulties falling asleep or staying asleep, or you're waking up super early. That being said, I would say one practical way that I would recommend, or a couple of practical things that I would recommend doing to address that racing mind, is journaling as a form of mindfulness, right? So you could either journal or meditation before bed, making sure you have that incorporated into your nighttime routine. And the reason why that is helpful, if you think about it, especially as busy, for example, professionals or moms, where we've been going all day, we usually, get our kids tucked into bed. They have this wonderful routine where they talk about their day. We read to them. We have this lovely song and things, and they are like off to sleep. And then we just hop into bed. We don't have any time to transition. And so when you have some level of either journaling or mindfulness, or some level of some space to kind of reflect over your day, it helps declutter your mind a little bit. It allows you sort of process and let go of things that are really out of your control. I would recommend doing that before getting into bed. And I've seen that really dramatically change just the level of mind racing that parents experience. Another thing you could do in that, when you're doing that journaling activity, is kind of write a list of maybe things you're supposed to do tomorrow, right? So it's not something that's now running in your mind like, oh, I need to check on this person or send an email or pay this bill. Write them all down. And so that way you've kind of, let it go, and you'll address it tomorrow, and then you could go to sleep. If you find that despite doing that, your mind is still racing, then usually what I'll recommend, especially if you're in bed and you're tossing and turning for so long, is to just get out of bed. Get out of bed and do something else, especially when you're now in that zone where you start to feel very frustrated about your sleep and you're worried about how, bad the next day is going to be. There's just really no point anymore. Just get out of bed, maybe do something calming and relaxing out of bed, and then get back into bed once you start to feel more sleepy.
You make a really good point here about all of the rituals we create for our children that are so restful, but we don't do that same thing for ourselves, right? There are all of these, this lead up that takes a whole half an hour, maybe, that you're doing all these things to help your child get into sleep mode, but we forget to do that for ourselves. You make a really good point there. So switching gears a bit to the practicalities of good sleep for kids, just sort of as a rubric, how much sleep does each age group really need? Like, do preschoolers and elementary age kids and middle schoolers and high schoolers, do they all need the same amount of sleep, different amounts of sleep? I know that teenagers need a lot of sleep. Like, what's the story there?
Yeah, absolutely. So the National Sleep Foundation has recommendations of the adequate or appropriate number of hours of sleep for people by age. So for instance, our newborns are sleeping anywhere from about 14 to 17 hours. So they need a lot of sleep because they're going through a period of very rapid growth and development. So they do need that sleep, right? And then as kids get older, say our preschoolers, for instance, 3 to 5 year olds, will need anywhere from about 11 to 13. And then our school age children, usually what we say they need from about 9 to 11 hours of sleep. And then our teens need about 8 to 10 hours of sleep. And then in adults, we usually will talk about 7 to 9 hours. So over time, as we get older, the amount sort of decreases a little bit. But overall, I think more importantly, beyond the absolute number of hours of sleep, because there's such a wide range, is to really see how you feel or how your child feels. So if they are having a hard time waking up, for instance, in the morning where they're groggy and they're exhausted, that might be a sign, regardless of what's going on, that maybe they need a little bit more, right? So maybe they're on the longer end of that range. versus they're ready to go and they're doing okay during the day. They're not sleepy or super duper cranky or having any behavioral issues. So I think it's really important to look at the child, see how they are, and then you can make some adjustments to say, you know what, I noticed every day that you have either a hard time falling asleep at night or that you're not getting adequate sleep. I see that, you're just having such a difficult time with regulation. So let's try to get you a little bit more sleep.
That's a good idea. It's interesting. I'm thinking about, as you say that, I'm thinking about my own child in the morning and how I usually am so groggy getting her out of bed. But she just pops right up like, what are we doing? Like she's just completely ready to go. Yeah. I'm just like, okay, give me 5 seconds.
I know. Let me breathe. I know. And yes. It's true. You know what? You bring up a very good point, because most of our kids will not, when we are sleep deprived, usually we're tired, we're exhausted, we feel sleepy. Most times our kids are on the opposite end of the spectrum, where they are very hyperactive. They may have frequent tantrums. They may be irritable, but usually they're not necessarily sleepy. And so that's something parents should pay attention to. So you don't want to wait until your child is like sleepy, because that means like they're really, really sleepy. You may see them.
You've missed your window or something.
Exactly. So you may see their energy level like ridiculously high. That may be a sign that they're actually tired.
Yes, yes. What can parents do in those early years, those infant years, during those 14 to 17-hour sleeps? What can parents do to build healthy sleep habits in those early times, those early months? Like, are there things they shouldn't be doing or should be doing during that time to create some good habits?
Yes, they're absolutely, it's never too early to start incorporating healthy habits for the family. I usually would not recommend, say, for instance, a baby or a newborn in the first 4 or 5 months of life. I don't recommend any type of sleep training or trying to put them on some kind of schedule or anything. They kind of make up their own schedule in that sense. But because that earlier stage, their brains are not yet developed enough to the point where they even know the difference between night and day. And that's why, and then they're feeding so frequently because they're growing. And so when they sleep in short bursts within those first few months, that's pretty normal and expected. But as they're getting older, even within that time, you could already start to put in some routines. Say, for instance, even though for your very, very small baby, they're sleeping for a majority of the day, but there's a time when night starts, right? So you could have a really short routine where you clean them up, you change them into PJs, you sing to them. You could start to incorporate those routines in, and our brains are just incredible. Our brains start to anticipate sleep when you start to do that on a regular, consistent basis. And what I recommend is, don't make it complicated, make it something sustainable, make it something pleasurable. So for some kids, they like to have a bath, and then maybe we read a book, and then some bonding time before we put them into bed. And so that's really something that I recommend. Almost like, and when people ask about like, okay, so what should be part of the routine? And I think there are really 3 main areas. It should be around hygiene, around bonding and connection, and maybe some reading of some sort. So, or communication, I would say. So, if we talk about the hygiene, that would be taking a bath, changing, into their PJs, brushing their teeth, or something of that sort. When it comes to the bonding time, it could be sometime just cuddling and, rocking them a little bit, or singing to them, or just talking and connecting with them on that level. And then in terms of communication, it could be reading to them or having them read to you, whatever that looks like. So those 3 elements, if you can make sure that your routine includes that, it's really, really, really helpful for your child.
Yeah, it's interesting. As you say that, I'm remembering that some of the things that we did when my child was an infant, we still continue to do those things now that she's 7 years old. And even just when you start them, she'll just yawn right away. just really just already. I know that I'm in a good spot. I'm like waiting for the yawn. I'm like, okay, we're in the spot. We're in the zone.
And that's exactly what happens, because her brain has been conditioned to do that. Like, it knows, oh wow, when we start this, then sleep is next. And when
Yes.
you do that and you do it in such a way that's very predictable, especially for young children, they anticipate it and you get less of a pushback because they just know this is what we do at home. It's not something random or like a luck of the draw, right? They know from here to here to here. And so I think that's really helpful.
It's true. As you say that, I'm realizing, at 7, there isn't as much pushback. But I do remember those 3, the 4, the 5s. There was, sometimes at bedtime, just so much resistance, so much stalling, so much, one more book, one more song, one more, just a lot of, and I don't see that as much anymore. Do you have any advice for parents who are in that more toddlery stage when there is a little bit more pushback at bedtime?
Yeah, no, that is so real. The struggle is real. It's very common. And, in some cases, it might be a little bit of a pushback and, eventually they oblige or whatever. But in some cases, it actually delays their sleep time significantly and they're tired and they're not going to bed for hours. And it becomes what we call insomnia, behavioral insomnia in children, because then it impacts the amount of sleep they can get and things like that. So one of the main things we try to do that, especially that scenario you just described is related to limit setting. And sometimes it's present during the day and it's also present at night. Sometimes it's only present at night. So I think one thing is important to address like what the issues are. Is your child scared? Is there some insecurities going on or something of that sort? Is there like a medical condition that's, pushing back? Are they uncomfortable or in pain or things like that? So you want to rule out anything serious. After that, I would say in most children, it's neither of the first two. It's just resistance, right? They don't want to miss out on all the fun, right? So a lot of times the strategies that I recommend are around, really curbing the, limit setting. And so that looks different for different people. Sometimes it could be things like, we use things like, we call it a bedtime pass. That's a very common, a very popular, very, very, very effective strategy, especially for that toddler age, where what happens is you create a pass or two. So literally cut up a couple of strips of paper and they keep it right by their nightstand. And so for every request, they have to trade in that pass. So we now don't have 10 or 20 requests. We have two or maybe most three, right? You want to set them up for success. And the conversation you have before that is, listen, you get two requests. And once you're done with the requests, that's it. No more requests. It's done. Like there are no more requests because they trade that pass in for the request. And then on the other end, you tell them, but you know what? If you keep those requests, guess who gets to trade the requests in for a treat in the morning? So then it kind of teaches them, oops, if I trade in my request now, one, they'll be very careful about what they're requesting, right? They're not going to want to waste it, right? They'll be better stewards of their multiple requests. And then two, they now have sort of the motivation to hold on to those passes so that they could trade it in for something during in the morning, either, pick something simple, favorite cereal, you get to make breakfast, you get to pick a breakfast of your choice, you get to, maybe you get a small toy from the dollar store, nothing huge at all. And if you can maintain that consistency, usually we're able to curb the bedtime resistance and get them sleeping on time.
Yes. What worked for me at times was to slow down a little bit and sort of turn up the connection a little bit. Sometimes I found that my child just wanted a little extra time with me. So if I could just sort of give a little bit more, a little more playtime or make it a little more fun or something more connected, then sometimes that would fill her cup a little bit and she'd be able to settle.
Oh, yeah.
So, but that was a challenging time. Those years were challenging. It's really nice that is behind me.
Yeah,
Really
and I
nice.
love that. I love what you just said because again, it's like looking to see what's going on. Which is why is there like anxiety? Is there stress? Are they do they feel emotionally like a little bit depleted? Do they need their love tank filled a bit? Is it that we've been so busy all day that even as, there's sometimes, let's be honest, there's sometimes when you're there, but not really there. You're just like, let's get this routine over with so that I can get back, right? And they can tell. And sometimes that's their own way of saying, I need you to be present. So I love what you just said. And I highly recommend that, because at the end of the day, it may just be an extra 2 minutes. And all of a sudden, you get their buy-in. So definitely an option to use.
Another thing that comes up in my practice is oftentimes is early morning waking. Some preschoolers who, they wake up at 4:30 a.m. and it's time to go. Like, when's breakfast? Like, I'm awake now, and it's still, for the parents, kind of still nighttime. I'm not really ready yet. Do you have any good ideas for, with this early morning waking? And it's not like middle of the night where you're going to go back to sleep necessarily. It's like, technically it's close to morning, but it's not really morning.
Yeah. I think that is something that also happens really, especially even with the time change, right? When we spring forward and things like that, where it seems like it's getting light out earlier, right? So in those situations, I think the first thing again is checking in, like, are we missing something? Are they, if it's a child that's not fully potty trained, do they need to use the bathrooms? Things like that, Is there anything else going on? And then in that situation, most times you really want to try to maintain that consistency in when they wake up. And so you don't want to feed into it and say, okay, you know what, you could go downstairs and watch some TV as long as you don't wake anybody else up. And that's something that we tend to do because it's like, listen, everybody else is still sleeping. The problem with that is you have to be careful because sometimes their brains now get conditioned to saying, oh, well, guess what happens? Every time I wake up early, I get treated with time in front of the TV, right? And that may not necessarily be what we want. So what I usually would recommend for that particular situation, sometimes it's where first of all, make sure the room is as dark as possible. So because any amount of light that's coming in, so it may be light from outside that's streaking in through either the blinds or something like that, that's enough for them to wake up. And our brains are very sensitive to light. And so if that's something that's going on, you want to just check. You want to make sure their room is really, really dark. You might need to get some blackout shades or blackout curtains or something of that sort. And if that's not the case, then I usually will recommend getting what you call an okay to wake clock. And that's something that works very often where it changes color at a certain time. Now, if for instance, you would like their wake up time to be 6:30 or 7 a.m., for instance, and they're waking up at 5 a.m., I wouldn't recommend setting the clock for 7 a.m. I would recommend setting it for maybe 5:30. So it's going to change color from say red to green at 5:30. And so they're not allowed to come out of their room until that said time, right? And then over time, when they're consistently waking up or staying in their room at that desired time, you could then start to push it back a little bit. And that tends to work very well. If they're in the room and you notice they're still waking up early, I would say focus on the light. Sometimes even the slightest, like I have kids who, sometimes the humidifier has like this tiny bright light. I don't know why does the humidifier have so much light, right? You could need to just use like a tape to just cover that up or something. So be very, very aware of that one.
One other issue that we deal with too is the waking in the middle of the night, like multiple waking up. Sometimes even in like those early elementary school years, like the 5, 6s, and just like waking up in the middle of the night a lot of times. And I'm wondering what you recommend for sort of settling kids back down and getting them back to sleep. And do you stay with them? Some parents are, do I just stay in bed with them? They sometimes come in my room. What is a good way of sort of getting everyone back to sleep again?
Yeah, that's also something that happens commonly. So one of the things I usually will say is whatever you need to fall asleep is what you need to stay asleep, right? So we all have the sleep associations and we do, right? Like I have my pillow, it's cool on one side over the course of the night. If it gets warm or uncomfortable, I might wake up and then I switch it over to the cooler side. Or if the pillow falls to the ground for some reason and I wake up, I'm going to need to pick that pillow up to continue sleeping. The reason why is because the last time I fell asleep, my brain associated my sleep with sleeping on a very cool pillow. So it turns out we all wake up in the middle of the night. Everybody wakes up. We wake up about 5 times or even more. And it's normal, right? We go through stages of sleep. We go through what we call sleep cycles. You go through light sleep, then you go to deep sleep, and then when you go to the dream sleep or REM sleep, and then you cycle through and have a very brief awakening in between those cycles, right? Those awakenings are called arousals. We're not even aware of it. We don't know, right? And our kids technically don't know unless the last time they fell asleep, there was something present for them to resume sleep. So, if, for instance, like I mentioned, the pillow, if, for instance, a parent was there, like you as a parent, you lay with them to fall asleep, for instance, and they fell asleep and then you left the room, when they're cycling through their sleep, they're going to have that brief awakening. But then their brains, right? Their brains will look out for, okay, am I safe, right? Is my parent here because my parent was here when I fell asleep last time? Is my pillow, my blanket, all those things that I fell asleep, is it still present? And if it's not present, then they wake up more fully and then they need that element, that parent or blanket, whatever it is, they need it to resume sleep. And so that's the principle. So funny enough, even though people come and are like, well, my child wakes up a lot, how do I settle them? We go all the way back to the beginning of the night. And I say, what's your routine like and how is your child falling asleep? I would say 7 times out of 10, parents are either with their child when they're falling asleep. And so the child is scared when they wake up because they need your parent. If it's a baby, sometimes they may be given a bottle and they fall asleep with the bottle. And then they wake up, they need that bottle. When we're able to then notice that association, what I recommend doing is breaking that association gradually, as much as you can tolerate, as fast or as slow as you can. So if you're a parent that needs to be there, then we kind of have to work you gradually out of the room. Only focus on the nighttime for that period. Because in the middle of the night, if you're trying to do all that, everybody's going to be frustrated and nobody's going to get asleep. So in the middle of the night, if you have an awakening, I would say just do whatever it is you need to get us to sleep, and we just focus on bedtime. Once we're able to address that independent sleep at bedtime, then as your child wakes up, typically they'll be like, oh yeah, I fell asleep. The last time I fell asleep, I was here by myself with my blanket. No parent was here. I'll be able to resume sleep again. So really that's the strategy. I wouldn't pay too much attention to the middle of the night if your child needs you or needs a bottle or needs some kind of crutch to fall asleep.
So focus on what you're doing in the moment of putting them to bed, those rituals at bedtime, and see what you can tweak there.
Yeah.
Okay, that makes a lot of sense. And so as we're coming closer to the end of our time together, I'm wondering, in all of your travels in sleep hygiene, what's one of the things that, is maybe a myth that you want to clear up about things that parents might think about sleep or sleep hygiene?
I think for parents, two things. I would say one is for the parent and then one is for the child. One thing I hear a lot of people say is my child is a bad sleeper. It's very common and it sounds very benign. But the thing is, usually we say within earshot of our child too. And I would say your child is not a bad sleeper. Your child may need you to fall asleep and may have maybe some sleep struggles, but every child can be taught to sleep well. They can have the skills to sleep independently. And, if not, if you need help, there's help out there. But bad sleep is not who they are. They may not sleep well, but it doesn't really define them. And so I think that helps a lot, because when people come in and say, well, my child is a bad sleeper, my firstborn slept well, the secondborn is a bad sleeper, I was a bad sleeper, like it almost seems like, well, there's really nothing we can do, this is how they genetically built. And I think that's something that I really advocate for parents to sort of think through. It sounds very benign, and then the child too is like, well, I'm a bad sleeper, so I'm gonna need you. So at the end of the day, it doesn't help or serve us.
Using those labels, sort of, we sometimes live into those labels.
Yes, we do. And then the other piece is for the parents is the myth of I need 7 to 9 hours of sleep. And so it becomes this like, something we fret over and we feel like we've fallen short because we didn't get 7 to 9 hours, because we brought our phones into our beds, or because our mind was racing. And then it becomes a guilt trip, right? That's not the goal. Like I mentioned, 7 to 9 hours is the recommendation, but there are people that sleep a little bit less than that. There's some people that sleep a little bit more than that. And so really finding who you are in terms of how do you feel when you wake up? How do you feel during the day? Do you need caffeine? Are you taking naps like nonstop all day? Then you kind of work your way back and say, okay, I think I need a little bit extra. But that 7 to 9, it sometimes it locks us in and ends up creating a lot more anxiety.
Yeah, that's a really good thing to remind us of, especially parents can give themselves such a hard time about so many things that it really does make good sense to be self-compassionate, right? And be easy on yourself and try to sort of tweak things little by little rather than just deciding that you're a failure at something.
The parenting journey is hard enough already, right?
I'm telling you.
Yeah.
So thanks so much for being here with us. Thank you for giving us your expertise and sharing your knowledge with us. And I'm sure I'll have many, many more questions. I may have you back. I know I'm talking a big game with my good sleeper, quote unquote.
Yes.
But who knows what it'll be like. I might be calling you.
Yeah.
But thanks so much for being here and sharing your time with us.
Oh, thank you. I really appreciate it. And I've had just a great time chatting with you.
I hope that's helpful. You can learn more about Dr. Afolabi-Brown's work at www.restfulsleepmd.com and follow her on Instagram at restfulsleepmd. You can learn more about my work with parents at www.brooklynparenttherapy.com and follow me on Instagram at bkparents. If you have more questions about family sleep hygiene or any other parenting questions or stories, leave me a message at 646-926-3243 and be sure to let me know if it's okay to use your voice on the show. Or send an email to parenthood@quickanddirtytips.com. And don't forget to subscribe to Project Parenthood on Apple Podcasts, Spotify, or wherever you listen to podcasts. Catch you next week. Project Parenthood is a Quick and Dirty Tips podcast. It's audio engineered by Dan Firebend, with script editing by Adam Cecil. Our podcast and advertising operations specialist is Morgan Christensen. Our digital operations specialist is Holly Hutchings. Our marketing and publicity assistant is Davina Tomlin. And our intern is Cameron Lacey.